Hi, I'm Susan Taylor with Scripps Health in San Diego, California. You're going through your day, and then all of a sudden, you get double vision, or your speech becomes slurred, or you have significant weakness on one side of your body. You might be having symptoms of what is called a TIA, a transient ischemic attack, otherwise known as a mini stroke. How do you diagnose and treat it? And are there ways that you can help prevent it? Joining us to talk about this is Dr. Mary Kalafut. She is a neurologist with the Scripps Clinic Medical Group in La Jolla, California. She is the stroke medical director for the Scripps Health System. Doctor, thanks so much for being with us.
My pleasure.
So go into a little bit more detail. What is this TIA, this mini stroke?
So a TIA or mini stroke is a lack of blood flow to the brain for a short period of time. So one of the blood vessels here in the brain gets closed off for a period of time, and then the blood flow is restored and the brain function is back to normal.
And how long do these symptoms last?
These symptoms typically last on the order of minutes, sometimes seconds, but not longer than minutes usually.
Okay, and so it would be double vision, slurred speech, weakness on one side, any other symptoms?
Yes, there are other symptoms that can be indicative of a transient ischemic attack. And the American Heart and American Stroke Association have come up with a mnemonic to help us remember what the warning signs are for a TIA and stroke. And the mnemonic is be fast. B means balance, so all of a sudden your balance becomes impaired. E means eye, so you could have double vision or lose your vision. F meaning face, meaning that one side of your face is drooping compared to the other. A means arm, so that you extend your arm and one of your arms is not able to be extended or it droops down. S means speech, whether you have slurred speech or you're using the wrong words. And then T is for time, meaning that as soon as you notice this, you need to get help immediately because time is brain.
How is this different from a regular stroke?
So the difference between a stroke and a transient ischemic attack is the amount of injury to the brain. So when someone suffers a stroke, there's actual injury to the nervous tissue, the brain cells themselves. When there's a transient ischemic attack, the blood flow is restored and there's no injury to the brain.
What causes this TIA, this mini stroke?
So there can be many causes for a transient ischemic attack. One can be a clot coming from the heart and then traveling from the heart and going to the brain. This typically occurs when you have an irregular heartbeat, especially something called atrial fibrillation. Another etiology or cause for the stroke would be some cholesterol buildup in one of the major blood vessels in the neck, whether it be in the back or in the front here. A little piece can break off and go down and close off one of the blood vessels inside the brain. And then finally, we can have evidence of cholesterol buildup in the blood vessels inside the brain or some of the smaller blood vessels inside the brain closing off.
Is there lasting damage from a TIA?
No, so because a TIA is just a transient episode, what can happen is with the blood vessels inside the brain, the clot forms here, and then the body breaks down the clot. It gets taken away, and there's no actual damage to the brain. So therefore, you don't have any symptoms.
Is this a warning sign that you might be at risk for a major stroke in the future?
Yes, a TIA can be a warning sign for a major stroke. So typically, when you have a TIA, even though you're back to normal, it is very important that you get in touch with your doctor relatively quickly to let them know about it so they can do the appropriate testing and treatment.
And who is most at risk for this mini stroke, this TIA?
So people that are most at risk for TIAs include people that have diabetes, people that have high blood pressure that's not well controlled, and people that have cholesterol that's not well, elevated cholesterol that's not well controlled.
And in terms of risk factors, is it different, the risk factors among women as compared to among men?
No, the risk factors are very similar. There's really not a difference between men and women in their risk factors. But again, the most important thing to do is to be in touch with your primary care doctor so they can help you manage these risks.
And let's say you start to get these symptoms. What should you do?
Well, if your symptoms last longer than about 5 or 10 minutes, it's imperative that you call 911 and get into the hospital immediately so you can be evaluated. The reason I say 5 or 10 minutes is because for transient ischemic attacks or these mini strokes, if they resolve within, they typically resolve within about 5 or 10 minutes. You still need to get medical attention, but it's not as urgent.
And if they continue longer than 5 or 10 minutes, you always say, do not drive yourself to the hospital.
Exactly right. So call 911 and they will take you to your nearest hospital. Don't ask your family member to take you or don't try to drive yourself, but calling 911 will help you get the quickest, most reliable treatment if you call 911.
And how do you diagnose this mini stroke?
Diagnosing the mini stroke sometimes can be a little bit tricky. And the reason I say that is because, as you can imagine, if you're completely back to normal and your brain scan's completely normal, sometimes it's a little difficult to make that diagnosis. But we, as neurologists, have seen many patients with these problems. And so, with our ability to examine you and talk to you about your symptoms, we generally can make that diagnosis.
So how do you treat the mini stroke?
Well, what we do is we work on your risk factors. So number one, if you're smoking, you need to stop smoking. If you're overweight, we need to work on changing your diet and exercise. If you have problems with blood pressure, we need to get your blood pressure under control. If your cholesterol is elevated, we need to work on that as well. Also, if you have diabetes, getting your blood sugars under control. And then finally, we usually use a blood thinning medication for prevention.
Are there differences between women and men who suffer a mini stroke in terms of their recovery?
So, a TIA, by definition, you don't have any residual effects. So, after a TIA, you're completely back to normal. And so, there's really no difference between whether you're male or female and how that happens.
And what about surgery to unclog your carotid arteries? These are the main blood vessels that supply blood to the brain. Talk about that. How long is that surgery? How long are you in the hospital? What's the recovery time?
So the carotid arteries are the two main blood vessels in the front of our neck here. You can kind of feel them pulsating there. If you have narrowing of those blood vessels due to cholesterol buildup, there are different ways that we can take care of that to prevent stroke. This is usually you can have something called an endarterectomy, where they actually open up the blood vessel and take the cholesterol buildup out. Or you can have a stent placed, which is a less invasive way of taking care of the clot and cholesterol buildup.
And if you have this surgery, what's the recovery time? When can you get back to resuming your normal activities?
So usually these are very quick to recover from these types of surgeries. Usually you spend a day in the hospital, and then after that, it's just a few more days till you can get back to your normal activities.
If you have a TIA, does this increase your risk of having another one?
It really depends on the cause of your TIA, but it is important for you to get in touch with your primary care doctor so they can get working on your risk factors. If your risk factors are under control, then your risk, of course, goes down.
Are there ways to prevent having a TIA, this mini stroke?
Prevention is really the key in what we're looking for TIA. So making sure that you have a healthy diet is one really important way to prevent a TIA. Of course, no smoking and decrease your alcohol intake. And then having a exercise regimen is also very helpful in preventing a TIA.
When should you go see a doctor?
Well, of course, I think we all need to see our doctors at least once a year to check in. Okay, what is my blood pressure? What is my cholesterol? How's my blood sugar? So I think at least once a year to try to identify, are you having any risk factors that need to be modified? If you are identified to have one of these risk factors, then your doctor will work very closely with you to determine how frequently you need to be seen again and what medications to start on.
Why are these mini strokes so important? If you have one of these, this is something you should not ignore.
Yeah, I think that's the most important question, Susan. And the reason I say that is because you can think of this as a way that you've kind of dodged a bullet. Okay, you were given a warning sign that, look, there's a clot here in one of the blood vessels in the brain. Thank goodness it broke up and there was no damage to the brain. But this is now our chance to say, what can I do differently? How can I change my lifestyle or medications so that I can prevent this from happening again? Because once that happens, you really have this great opportunity to start working on your risk factors and preventing this from happening again.
If you don't get a handle on this, what can happen down the road?
Well, then you're at an increased risk of having a stroke. And as we talked about before, a stroke is actual injury to the nervous tissue, injury to the brain. And depending on how much of the brain is involved, there are deficits that you will experience because of that.
Any final thoughts, doctor?
I think the most important thing to do is if you are having symptoms and they last more than 5 or 10 minutes, you call 911 and get into your nearest emergency room, as well as having a healthy lifestyle by exercising, eating the right foods such as a Mediterranean diet, and managing your risk factors.
Doctor, thanks so much for being with us. We appreciate you taking the time.
My pleasure. Thanks for the opportunity.
If you want more information on mini strokes, how to diagnose, treat, and prevent them, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.